Healthcare organizations today face two critical challenges: improving quality of care for patients while simultaneously controlling rising costs. Data is often fragmented across claims, clinical systems, assessments, and real-time feeds, making it difficult to identify risk early and act effectively. Hexplora was built to solve this problem by turning complex healthcare data into actionable insights that drive better outcomes and lower cost of care. Welcome to the Hexplora Population Health Dashboard. This single screen replaces dozens of spreadsheets and manual reports. First, notice the dynamic filters at the top. Tax ID TIN filter. I can view data for a specific provider organization or see the entire population. Provider ID NPI filter. Drill down to individual provider performance. When I change these filters, every metric on this dashboard updates in real time, powered by Snowflake queries that execute in milliseconds, even across millions of claims. The middle panel shows key population metrics, but these aren't just simple counts. Each metric incorporates AI-driven risk stratification. 4,314 total members, but more importantly, 2,579 rising risk members. The AI identifies these patients by analyzing multiple factors in Snowflake. RAF score increases over previous year, cost growth ratio exceeding 1.3 times, ER utilization spikes. This solves a critical U.S. healthcare problem, identifying deteriorating patients before they become critical. Traditional methods miss these patients for 6 to 12 months. In fee-for-value models, these 425 patients will drive 54.6% of total costs. Identifying them accurately is the difference between profit and loss. Let's go to the paid amount by claim type, a critical view for understanding where healthcare dollars are actually going. This donut chart shows the distribution of $43.4 million in total paid claims for 2025. This tells us that targeting physician and inpatient claims, just 70% of spend, will yield the highest ROI for care management programs. As we scroll down to advanced analytics, this section provides a detailed breakdown of each risk category. For every category, we display the total number of patients, the associated total cost, and the corresponding PMPM cost, giving a clear view of both population size and financial impact. In the cost analysis section, we present the cost distribution across risk categories, along with the top 10 highest cost members and their corresponding costs. In readmission analysis, we highlight readmission risk by category, including the average annual cost and risk score associated with each category. In the chronic conditions section, we display the number of patients by chronic condition, along with their associated cost and risk levels. The quality gaps section shows the distribution of patients by priority, the coverage percentage for each quality measure, and the potential savings the organization could achieve by focusing on these measures. In HCC analysis, we present the number of HCC conditions along with the corresponding patient counts. In the PCP visits section, we show the top services by visit volume and cost, followed by a detailed PCP visit analysis displayed in the table below. As we scroll down, AI-powered recommendations identify critical risk patients, preventable readmissions, and the potential cost savings from avoidable admissions. Now let's move on to the member profile report. Now, let's search for a member using their member ID or member name. Once the patient ID is selected, the user is taken to the member profile. This is the member profile report, a complete 360-degree view of an individual patient, designed for care managers, coders, and clinicians. At a glance, we see demographic, risk, RAF score, annual cost of the member and provider details in the header section. The utilization metrics section reveals this patient's care patterns at a glance. The cost analysis section at the right shows financial trends over 4 years. And if scrolled down, the chronic conditions section shows the patient's disease burden at a glance. 5 active conditions. This patient has significant clinical complexity. The HCC details table tracks every hierarchical condition category, the foundation of risk adjustment. The quality measures section tracks HEDIS performance, directly impacting star ratings and reimbursement. Going to the utilization tab. The Utilization tab provides a complete view of healthcare activity. The donut chart shows claim type breakdown. The dual-axis timeline tracks monthly costs, blue bars, and claim counts, red line, over 12 months, revealing utilization patterns. Summary cards show total claims, total cost, total services, and unique providers, all at a glance. Scrolling down reveals the top 10 diagnoses for the patient and the corresponding cost. Switching to Claims View shows detailed claim level data, and when the AI care plan is selected, an AI-powered personalized care plan is generated. The AI analyzes all member data and produces executive summary, clinical priorities, care management interventions, follow-up schedule. Selecting AI predictive analysis enables forecasting of future health events along with associated confidence scores. This includes predictions for readmission risk, ER visit likelihood, and hospitalization risk, allowing care teams to understand both the severity of risk and the confidence of each prediction. When the Action Plan tab is selected, we present a comprehensive care plan designed to help the patient improve their health. The application also includes an integrated healthcare chat that answers questions about the patient in real time. For example, when we ask about the member's specialty visits, it indicates there are 2 visits, which can also be verified in the Overview section. Hexplora Healthcare Insights goes beyond traditional analytics, demonstrating the power of combining Snowflake with cutting-edge AI to drive actionable healthcare insights. This concludes our application demo.